Good morning. My name is Brenda Diaz. I am a senior nursing student. So I will be talking about mental health and nursing students. What is mental health? According to the CDC, mental health includes our emotional, psychological, and social well-being. It can affect how we think, feel, and act. Our mental health can determine how we handle stress, relate to others, and make healthy choices. Mental health is vital at every stage of life, from childhood, adolescence, through adulthood. More than 50% will be diagnosed with a mental disorder or illness at some point in their lifetime. 1 in 5 Americans will experience a mental illness in a given year. Poor mental health can lead to suicide. Suicide is the second leading cause of death among people ages 15 to 34 in the United States. So I decided to ask, in BSN students, does mental health counseling improve academic achievement? And to answer my question, I focused on 6 articles. For my first article, the main objective was to determine mental distress and its effects on academics self-efficiency. This was a self-report study. They invited 2,430 full-time students under the age of 35, and only 749 answered the survey. This study found that half of the students reported having a mental health problem before beginning their studies. The other half had a higher mental health problem among university students than the general population in the same age group. Another finding of the study was that students who reported symptoms of mental health problems were twice as likely to report delays in their academics. For my second article, they used an uninterrupted time series to examine students' pre-counseling academic success compared to their post-counseling academic success and changes in grade point average, also known as GPA. This study consisted of 1,231 participants that were seen by 49 therapists. All students were required to attend at least 2 counseling sessions. They found that students who regularly attended counseling sessions received a higher grade than students who did not attend regularly. Students' GPA increased by 0.02 every semester post-counseling. For my third article, they interviewed 13 nursing professors and collected data over the course of 3 months. Nursing students experienced more anxiety and depression than general college population, which I'm sure my classmates can agree with that. The students who were not prepared for nursing stressors experienced a greater risk in their mental health. The students who were, this study suggested that up to 90% of students with a mental health issue in college did not seek help. Similar findings throughout these interviews were that professors didn't know how to help the student, or they had a hard time reacting during a conversation, or professors didn't want to interrupt their faculty-student boundary. And most of the time, they didn't realize the student was in distress until they were in a crisis. All professors agreed that working with students who had mental health problems was stressful on top of doing their coursework and schoolwork. In conclusion, the nursing educators agreed that students should be required to receive psychological support to promote their wellness and academic success. For my fourth article, it consisted of 2 studies. The first study included 1,049 students, and the second study included 39 students. Both studies found common factors that students don't reach out for help because they lack to recognize that they have a problem, or there is a lack of available mental resources, as well as a lack of cultural mistrust. Personally, as a Latina, we aren't taught to share or express our feelings. So many students were ashamed of going against the regular norm or being called out in front of their friends. The fifth article was a cross-sectional study with 330 nursing students. It determined that students that were exposed to academic and clinical stressors had an increase in anxiety and depression. They found that 19.7% of the students had moderate anxiety and 25.2% had severe anxiety. The increase in depression and anxiety had a big influence on their psychological well-being. This study found that mindfulness meditation programs had a positive impact on the nursing student, and overall it helped improve their well-being. My last article consisted of a systematic review of 7 studies. Throughout these studies, they focused on mindful meditation, breathing techniques, and increasing the students' awareness of their internal feelings. They found that stress and anxiety were common factors in the students' mental health problems. The students who had more stress with clinical work and schoolwork had lower grades. They used mindful meditation, including mindfulness walking and mindfulness breathing, to help improve their mental health symptoms, like stress, anxiety, and depression. With the improvement of these symptoms, it led to improvement in their overall academics. Throughout my articles, I found there were multiple aspects that affected the students not reaching out for help. That included fear of not being accepted or acknowledged, no support from faculty, family, or friends, and students did not want to stand out by being the only person who was struggling. Many students did not know they were struggling, so they didn't seek help. A few of the limitations in the articles included small group sizes, that this could have led to inaccuracy in results. The surveys were also self-report, so it could have led to not receiving enough information, since it could have been possible that students didn't feel comfortable sharing. And the participants were also self-picked by the researchers, so this could lead to biased results. So why is mental health important for your overall health? Depression can increase the risk for diabetes, heart disease, and stroke. Therefore, prioritizing mental health in students can lead to better health. Improved mental health can lead to retention in classes and improvement in their overall academic success. As a nurse, you have to be able to provide care for an individual, and you should be mentally, physically, and emotionally well. We can't take care of others without caring for ourselves first. Having a better understanding of someone's mental health can help, it will be easier to provide care and support for them. So we should be having more conversations about mental health. Make it a topic that's easier to talk about. There should be more encouragement to attend counseling and not be seen as a bad thing. Faculty shouldn't be afraid to talk to students. We should make sure we check on our friends. It is important in nursing and in any area of our life. You never know what anyone is going through, and maybe a simple "how are you" can start the conversation. In the end, talking about mental health and finding ways to help will improve and help provide better academic success and well-being in the student's career. So what are some things that you do that can help improve your mental health? A few things that I have found have been going to the gym, journaling, and dancing. So is there anything that you guys do that promotes or that you use to help your mental health? Yes. So April is actually Stress Awareness Month and May is Mental Health Awareness Month. So I would like to invite all of you to talk about your feelings, encourage the conversation. You aren't alone. There may be other people who are also struggling, and ask for help, eat well, practice meditation, journaling, and also Piedmont offers a virtual health, which they have free counselors there. And like I said, it's free. So thank you. And is there any questions?